Hello, everyone. I'm Dr. Jobe, and welcome to the first episode of Tell Me About Your Specialty. Hey, everyone. So, Dr. Jhing Talan is a pediatrician in a government hospital, and I'd like to ask her more about what she does right now.
Hi. So I'm a pediatrician. I just finished my residency training in 2018 and in a government hospital. So since then, I tried moonlighting for a few months and then I worked again in a government hospital. So now I'm involved in treating service patients and I'd like to involve myself in training the residents. So it's really my passion to teach them.
Wow, that's a lot. That's a lot on your plate right now. But before we go to pediatrics specifically, doctor, how did you get into medicine? Like, that's the big question that everybody asks. Like, why medicine? Why be a doctor?
Well, for me, it was a fast decision. It was a quick decision to make because my mom actually graduated medicine. But since I was born, she decided to become a full-time homemaker. So she wasn't able to practice being a doctor. Therefore, nung bata pa lang kami, all of us four children really wanted to become doctors para ma-fulfill namin yung pangarap ng nanay namin. But along the way, some of my siblings decided to take a different track. But for my older sister and me, we decided to still pursue becoming doctors. Masaya naman. Hindi ko naman regret yung decision ko. And during interviews, diba, they usually ask us if you're not a doctor or if you're not going to medicine, what would you do with your life? I think I'd still be taking a pre-med course and eventually pursue medicine. So I'm pretty sure that this is the track for me ever since I was young.
Wow, so it's all or nothing but
Yeah.
medicine for you. That's really that's exceptional. I see. So I see so much why you have passion for medicine. Since we're on the topic of med school, were there certain subjects that you love, or there's some certain subjects you had a love hate relationship with?
I like that question, but it's difficult to answer. I'm sorry to all my pharmacology teachers, but I really hate pharmacology. Up to a point that the head of the was it a section or a department or basta the pharmacology head talked to me face to face and told me, Jing, you have to study. Study like you've never studied before. Study like this is the last exam of your life. If you really want to become a doctor, you must really study. And it was hard for me because I don't understand pharmacology. I mean, it's really hard for me to understand it kasi parang molecular siya or hindi ko siya nakikita, nahahawakan. So it's hard to
Mm-hmm.
understand. But all of us have to go to pharmacology. So, kailangan ko siyang tiisin. After the section head talked to me, I studied, I asked help from my friends. Then eventually, I passed naman that exam and was promoted to the next year level. So I don't really like reading books and parang studying something I can't see, I can't touch, I can't appreciate it if I don't have an experience of it. But when I went to the clinics, when I went to clerkship and internship, I really had a fun time because I can interact with the patient. So when I see someone with like edema, and I know I should have known this from med school, from the earlier years of med school, but I had a hard time studying my books. That's the time I was interested to learn more about it, and that's when I read it on my books. And I have a greater appreciation of it. Tapos mas na-apply ko siya sa pasyente ko. So that's how I learn. I want to see something happening. I want to know what's the significance of this. If this is not significant, I don't want to study this. But after seeing my patients, this is significant because if I know this, I can treat this and I can help this person. It makes it easier for me to study these things. So, hate subject pharmacology, but now I'm learning to love it. Subject that I love, I think everything which involves interacting with people. So it's pathology, radiology. It's not really for me because I really want patient interaction. So that's also another tip for
Mm-hmm.
those people who thinking what to get after med school, what residency training to take, you'll have a clue also. Do you want interaction with people or you don't want it? So medyo may clue na sila doon kung anong bagay na residency training for them.
All right, you heard that, everyone. So if you like people, you know what to cross out of your list, and if you don't like people, you know what to add on
Yes.
your list. But wait, Doctora, isn't pharmacology like super like crucial in pediatrics, like the computation? So if our viewers right now are watching, they're like, isn't they computing the MKD, MK dose? So how did you deal with that? Like how did you like learn to get to get good at that part of pharmacology?
Actually, I like math and physics. So these are the subjects na I enjoyed during my pre-med phase. So I enjoyed that part of pediatrics, the unit analysis, finding the value of X also. I like
Mhm.
doing that. So I enjoyed it in pediatrics. And of course, we don't need to memorize all dosages. So, pwede naman balikan yung libro. But some medications that we use um, more frequently, kailangan alam namin yung dosages nun. Pero for other medications, pwede naman tingnan yung Harriet Lane. So, that's one of the go-to books in pediatrics. So, it's fun. It's fun. It's really math. And for those who love math, pediatrics is the way to go.
So sa mga nagsabi dyan na I'm gonna be a doctor, I'm not gonna need math, think again. In med school, was there a certain like event or a certain person or place?
Actually, I really wanted to become a surgeon. When I was in med school, I would always tell my residents, the residents who handled me na, hintayin nila ako sa surgery residency. And looking back at my pediatrics rotation, parang so-so lang. Even my grades are just average. But I have significant experiences in my pediatrics rotation. So yung mga masaya, mas masaya. Yung malungkot, mas malungkot. Parang mas vibrant yung naging experience ko when I was going through my pediatrics rotation. So after I finished med school, I had some time to think and pray about what to do with my life. And then I came with a decision that I wanted to prioritize having a family in the future. And after interviewing surgeons and clinicians about it, gathering some information, yung pros and cons, I came to a decision na perhaps becoming a pediatrician would be more supportive of a family life. I'm not saying na yung surgeons, bawal sila magpamilya o wala silang oras sa pamilya. I'm just saying perhaps it's more manageable kung hindi ka nag-oopera ng madaling araw. Surgeons and anesthesiologists, they have to leave early in the morning because that's the time they do surgeries. Pero ako, I envision my life to have my mornings free, to spend time with the kids, if I would ever have one in the future. So, inisip ko, parang mas fit doon yung pagiging pediatrician. So, that's why I pursued the pediatrics residency training.
I see. Since you brought up like family life, having time for kids, do you have a suggestion, or like since a lot of our colleagues are quite curious about when should they get married, when should they get into relationship, like what age, this like they say there's like a biological clock, especially for your female colleagues. They always ask that. Like, so do you have any tips or suggestions on how they could plan out or like decide on what could be the best timeline for
That's a
them?
very hard question because kahit ako, nahirapan akong i-plot yan sa buhay ko. I mean, we humans can only plan, and yet we are still not certain of what will happen in the future. So, I think I'm not the best person to ask that question, but I can share some of the things I learned from the people I interviewed. It also depends on your priorities. For some people, they want to have more time with their children habang bata pa sila. So I have met some doctors who decided to pursue married life and have children before pursuing residency training or fellowship. Pero nahirapan sila kasi syempre it's very taxing to go on duties every now and then. And as you grow older, mas mahirap ibuhos yung energy sa ganun ka-demanding na training. Um, but some people do it also during fellowship. Parang most of them would have family first, would have children first before pursuing fellowship training. But most of the people I know, after med school, diretso sila residency, and then fellowship, then afterwards, they pursue a family. So for people in a relationship, well, decision nila yan kung kailan nila gustong i-pursue yun. At kung supported pa yung partner nila. Example, doctor ba yun, yung kapartner nila? So would they understand the timeline? So yun yung mga dapat i-consider. But for someone who's single naman, lalo na for females, wala namang magagawa about it. Diba? We have to wait for someone to pursue us, and then eventually we plan together kung when to pursue family life or residency or further training.
I see it's so much wisdom coming from your answer. Like actually you might be the one of the best persons to ask this question. So let's talk about your pediatric residency.
So I had my pediatrics residency training in Philippine General Hospital. And as you know, toxic siya na environment. But I'd like to say na I think halos lahat naman ng residency training for pedia is toxic. But people have this notion na benign kami because, we wear the scrubs with teddy bears, we are cheerful, we smile all the time. But in reality, it's toxic and demanding in a way that in PGH, when a patient is intubated, pag sa IM, pwedeng student yung mag-conduct nun sa x-ray or kung may anumang procedure. But for pediatrics patients na intubated, kailangan residents. Tapos, syempre, yung mga IV insertion, we tease one another na kami yung alalay ng ospital. Because when there are patients from like ENT or OFTA who needs to be operated on and they can't get IV access, they always to us in pedia. And we have to do it for them because kami yung mas trained then or mas sanay. Masaya siya. It's very fun. And of course, maraming cute kids. Wala naman masyadong adults na cute na pwede mong sabihin, oh, yung cute-cute mo. Walang ganun. Pero in pedia, we have lots of cute kids. But of course, it's much more painful to see them when they're dying or when they're intubated or deteriorating.
Yes.
Also, a good opportunity for me. I think one of the best things about pediatric residency is that you get to involve the entire family on how to raise their children. Because these children, marami pa silang matututunan eh. So I think our role is very pivotal in making sure that families are they are informed on how to raise their children well. So it's a very good opportunity to influence other people in a much larger scale na hindi lang doctor-patient. Pero this is doctor-patient, the child, and then the family of the child. And the surrounding environment, like the extended relatives, minsan pati kapitan, pati tanod involved. So that's the Filipino culture. So I'd like to see that Filipino culture na many people are involved in raising a child as a big opportunity for us to influence more people.
Is it actually harder to talk to the parents of the children than the children themselves?
Yes. Actually, mas mahirap ngang kausap yung magulang. And I have seen a spectrum of parents. Some really ask good questions, very relevant questions. Some, on the other end of that spectrum, some just don't ask anything or parang they don't care, seemingly, but probably they are dealing with a difficult situation in that way. So it takes patience and understanding from the pediatrician um, to help the parents understand what their children are going through. What I do as a tip for our pediatrics residents, what I do is I give instruction to the parents. I explain to them the illness and the things that they need to do or they need to prepare. And then afterwards, I ask them to repeat it to me. So I ask them, so ano po yung sakit ng anak ninyo? Pakiulit po kung naiintindihan ninyo. Then they say it, and I ask them, ano po ang pagkakaintindi nyo doon? Then they mention it to me. So some words stick, but some don't. So I had to supplement and repeat it again. Or what happens is, di ba you explain it already to the parents, and then the tito, the tita, the lolo, lola would come. And then they would ask you, Doktora, paki-explain nga po sa
Yeah.
relative. I would tell them, sige po, paki-explain po sa kanila, makikinig po ako. Kung meron po mga kulang o may mga bagay po na hindi kayo naintindihan o hindi nyo maipaliwanag ng maayos, tutulungan ko po kayo magpaliwanag. So, it gives me a gauge of how well they understood the condition of their child pag na-explain nila in their own words sa relatives nila or na-explain nila pabalik sa akin. Especially when you discharge them, when you allow them to go home and they have to go back, they have specific instructions. What we usually ask them to do is to repeat it back to us para gets namin na naiintindihan nila.
So raising a child is really a community thing. Like it takes everybody in the community. Is there like some people, they tell me when they go into pediatrics, they find a certain age group, like, oh, I really can't deal with this age group, or I can't deal with adolescents or teenagers like that.
Alam mo, it's true that the adolescents are really hard to deal with because they are children and partly adults. What I like about children is most of them don't lie. When they feel pain, they really cry or you really see it in their faces. Some people find it difficult to interpret babies because they just cry. But I think it's actually easier to interpret because they're very transparent as compared to adults. When you ask them, maraming
Mhm.
mask, they don't want their families to worry about them when in fact, they're not okay. So yung adolescents, medyo may gano'n na sila na um, phase na nagsisinungaling na sila or siguro hindi na naman nagsisinungaling. They're trying to conceal what they really feel, what they experience. And of course, this is the phase na may surge talaga ng emotions. So, eto rin yung time na yung frontal part ng brain
Mhm.
nila nagde-develop pa rin. So, some decision making, hindi pa ganun ka polished. So, eto yung time na because of the surge of emotions, medyo mahirap din talaga silang intindihin. Plus the environment, yung mga concerns nila at that point. Kaya mahirap. But I think it is also a very good time to influence them. I have this fellow before, adolescent medicine fellow. And he said, these adolescents, you mold them at that phase na sobrang ganda pa ng absorption nila ng influence from the environment. Then what a blessing to mold them in a good way so that eventually they will influence us in a good way or parang they will have the power to influence the nation in a good way. So it's really amazing na to see it in that light instead of yung iniisip lang na, mahirap silang intindihin. Pero, medyo hirap nga silang intindihin. What I like most when I was in training, the neonates, the newborns, because madali silang
Mhm.
maintindihan. More or less, simple lang yung mga concerns din nila. Or very rare lang yung mga complicated cases, yung mga may multiple congenital anomalies. But the usual infections, more or less, yun din na paulit-ulit. So you get to master these cases. And wala, cute talaga sila. Cute yung mga babies. Wala pa akong nakitang baby na hindi cute.
Babies are cute, adolescents are difficult, but they're the future of the country. So we really got to take care of all the children. Since you spoke about mastering cases, is there like a certain skill set that you must possess to become like a successful
I think
pediatrician?
not only for pediatricians, but for all trainings, for all doctors, very important is to have the humility and
Mhm.
openness to learn new things. Because we come into residency training or fellowship, and we come into that training because we really don't know much yet. So as long as people are open to new learnings, humble enough to be taught by their mentors, then marami talagang matututunan. Like for me, hindi talaga ako magaling sa IV insertion as a medical student. But since I get to do it every day, practice makes perfect. Arterial blood gas. Minsan nagbibiroan kami na kahit siguro nakapikit ka, kaya mo nang gumawa ng ABG. Because we do it every morning. Like, lots of kids. We do it in lots of kids every
Mhm.
morning. Lumbar tap. during our hema-onco rotation, nakapila sila, tapos sunod-sunod ka lang na maglo-lumbar tap. So, we come into this training na hindi pa talaga namin alam. But because we are open to learning these things, we get to master these things. So, don't worry, kung hindi ka pa talaga asintado magswero, kumuha ng dugo, it's okay. You learn it along the way. So that's what I like about pediatrics, that you can do many procedures, which is similar also to surgery. Well, not in a large scale na procedure, but you still get to use your hands. So if you're a kinesthetic learner, bagay din talaga yung pediatrics residency training para sa'yo.
So you heard it, guys, mismo from Doc Jhing. Even if you're not good right now, there's still so much time to practice while in residency.
Yes.
So don't be afraid to go for the residency that you want. Imagine this scenario. If you were on duty in a deserted island and then you had a ward all to yourself. If you only had 3 things to bring on the deserted island as a pediatrician, what would you bring?
My Nelson's Pediatrics textbook, because it has everything. And then a gauge 23 Terumo needle, because it's very useful. And perhaps a stethoscope with a teddy bear on it.
Mhm. With a teddy bear,
Yes.
specifically with a teddy bear.
Because for children, when they see something new, minsan nakakatakot yun para sa kanila. But you introduce something familiar to their eyes, like a teddy bear or a toy, parang nag-ease up sila. You make them more comfortable or less irritable when you present a toy to them. So yun. To add to that more friendly vibe for our kids.
Right. Wonderful answer. Essential needs talaga. So now we talked about the past, we talked about the present. What about the future? Where do you see yourself in the future?
Miss Universe question. So right now, I will be pursuing a fellowship training in pediatric hematology and oncology. Konti lang sila sa Pilipinas, pero maraming bata ang nangangailangan ng hema-onco. So I want to pursue that. Hopefully, matapos ko. And my other hope is that I see it also as a niche wherein I can serve more people and find more joy and value in the work that I do as a pediatrician. So these subspecialty would deal with children with hematologic conditions and cancer. Marami sila talaga sa Pilipinas, but some would die undiagnosed, or some would not finish the treatment that they need for like leukemia. Kaya marami sa kanila hindi na pagtutunan ng pansin or hindi na susuportahan para makumpleto yung treatment nila. I hope to serve in that aspect of serving the Filipino people.
Hey everyone, so we're gonna play a game now. It's really simple. So as pediatricians, they have to be quite familiar with nursery rhymes and songs that make kids happy. So I recorded 5 nursery rhymes and we're gonna see if Dr. Jhing knows them all. Guess the tune, nursery rhyme edition. First song, here we go. This one's quite easy.
Baby Shark.
Baby Shark, definitely. It was an easy one. So do you even know the actions of Baby Shark? There you go. So she even knows the actions of Baby Shark. I'm sure you've heard this a lot in the wards. Okay, for our next song.
Head, shoulders, knees, and toes.
Yes! Perfect. So it's the song about anatomy for kids. Head, shoulder, knees, and toes. Amazing. You know your nursery rhymes. Alright, let's go to our next one. definitely. So Old MacDonald had a farm and he had lots of animals. You could make that song going and going. Just add a new animal in. So actually, ang ganda, di ba, ng Old MacDonald kasi it teaches kids animal sounds. Like, what do you think about it, Doctor? Like, the Old MacDonald song?
Yeah, I like that song because yeah, it teaches them about animals, and at the same time, when you communicate with children and you have highs and lows of your voice, of your tone, parang it makes learning for them more interesting and easier.
For future parents out there, highs and lows in your tone of voice, good for the
Yes,
child's
that's
brain
right.
development. All right, our next song.
The wheels on the bus go round and round.
Yes, wheels on the bus. Tama. So, ang galing. So you've got so far all the songs I gave to you. So the last one would be quite tricky. It might sound like a song that you know, but it isn't.
Okay.
Quick hint: this song became quite viral some time back. Like even adults were talking about it.
Hirap naman. Can you play it one more time?
All right, one more time.
Hindi ko talaga alam.
Hmm. So, finally, we stumped her. So, this song was actually Johnny Johnny. So, have you heard
Johnny
of
Johnny.
this
Papa.
nursery rhyme? Yeah. So, actually, Johnny Johnny sounds like Twinkle Twinkle Little Star and Baba Black Sheep, but it changed the last part of the song, where parang the father said,
Open.
"Don't lie," and then Johnny laughs, ha ha ha. That's why it ends like that. So if you're wondering how come it became viral, like why was it viral? So because of the, I think it was the line. Personally, just my personal opinion, I think it was the line where Johnny lied about eating sugar. So what are your thoughts on this, Doctor Jing? Like, is this a good nursery rhyme or is this a little problematic?
I think okay naman yung nursery rhyme na yan because um well, it's true that Johnny lied about eating sugar, but eventually he decided to show his father when he was laughing to show his father that there's sugar inside his mouth and he's eating it. So I think it also teaches children about admitting to their parents when they committed mistakes. So if you dig deeper into it, parang it also speaks about the comfort of the relationship between the child and the parent, that there is some um, comfort in there to admit that they are wrong and that they know that despite committing mistakes, they would still be loved by their parents. So yun, okay naman siya.
Thank you so much for that. Last, before we end our game, since we're on the topic of nursery rhymes, and we know that a lot of kids have access to the internet, they also do YouTube, but that's where they get their nursery
Yeah.
rhymes. So, do we have a recommendation for how long should they just be watching or using phone or their tablet or their gadget?
The Pediatric Society recommends zero screen time for children less than 2 years old, as in wala talaga. But for those 2 years old and above, the recommendation is a maximum of 2 hours of screen time. And they recommend that the screen time is guided with another adult. So when the children watch or in the television or in other devices, kailangan merong adult na kasama who interacts with them. Studies have shown that those who have more than 2 hours of screen time eventually develop signs and symptoms of ADHD. because these children want full control of their environment. Siyempre, pag nanood ng TV, pag ayaw mo, papalitan mo yung channel o mag-swipe ka lang, tapos yung next na. So,
Mm.
these children, parang hindi sila natututong maghintay or gusto nila, nasusunod agad yung gusto nila. Or they have lags in developing their social skills because hindi ka naman nag-eye-to-eye contact with the device or television. That's why you want that adult. So when Dora asks something and you don't answer, the adult would answer and would encourage the child to answer Dora. So there's also interaction with that. So there is social interaction. They learn skills about communication. That's why that is the recommendation of the society.
Future parents and parents with small children. So you heard what Dr. Jhing said about screen time. And if you want to learn more about adult ADHD and living with adult ADHD, I'll link the video up here. Thank you so much, Dr. Jhing Talan, for sharing your wisdom, your thoughts, your opinions. I think we've learned so much from you, and truly, years of experience, even 3 years of experience in residency, give you so much that you'd bring throughout the rest of your practice. So
Yeah.
thank you so much. Do you have any last messages for our viewers?
I think some of the viewers would come to your page because they also need help or an insight on what to take after med school. My encouragement for you guys is to just be the best doctor in whatever field you choose. If you choose to be a general practitioner, then be the best GP there is. If you choose to be a pediatrician, then be the best pediatrician there is. I'm actually not forcing anyone to go to pediatrics or go to any other field. Just choose what you're passionate about or where you can serve more, where you can make the most out of the skills that you have, the talents that were given to you, and just be the best person that you can be in whatever field, in whichever province, in whatever that you do. Just be the best person that you can be, and eventually you will help one another so that we can build a healthier nation. Hopefully, a very healthy Filipino nation, so that we can help in the progress of our country because health is an investment.
All of that for the Filipino
Yes.
children. Thank you for watching. Don't forget to like and subscribe. I want to hear from you in the comments down below on what other specialty you want me to cover next.